And last December, Loretta McPherson died at an Oregon hospital after being given the wrong medication. Now, a federal report says that was not the only mistake the hospital officials made that day. Wanda Moore has the story.
It's been 9 months since Loretta McPherson died at St. Charles and Bend. But for her son, it seems like yesterday.
There isn't a day that goes by that I don't think about her.
In December, St. Charles officials admitted to administering the wrong drug.
We thought we were giving one medicine and we gave a different medicine.
A fatal mistake, but according to a report by the U.S. Centers for Medicare and Medicaid Services, it was not the only mistake. The investigation also found that St. Charles violated patient rights and nursing protocols.
It's horrifying what they did.
According to the report, a nurse in the emergency room did not follow the orders from the doctor to hook McPherson to a heart monitor.
They not only administered the wrong drug, but if they followed their own procedures, drug recommendations, and their hospital policies, our mother would be alive today.
In a statement, St. Charles Chief Nursing Executive Pam Steinke says St. Charles and external experts determined that having the patient on a cardiac monitor would not have changed the outcome.
It's very clear that it would have had a different outcome if they would have had a monitor. She was directly across from the nurse's station, and alarms would have gone off saying that her health was declining.
Steinke also writes, quote, Loretta McPherson's death was a terrible tragedy that still weighs heavily on our caregivers. For McPherson's son, it won't bring back his mother.
If you could say something to your mom now, what would it be?
I'm sorry I ever brought you to that hospital. I love you and I miss you, and I wish that we could have brought you.
The investigation was carried out by the U.S. Centers for Medicare and Medicaid Services. Meanwhile, McPherson says he's still not sure if he's going to file a lawsuit against that hospital, but he wants to keep his legal options open.